Air travelers set a new pandemic record this Easter weekend. The TSA screened more than 1.5 million people on Friday. That is the most since the pandemic began. And they did it on the same day the CDC issued new travel guidance for people who have gotten vaccinated. For more on this, let's bring in Dr. Ron Elfenbein. He's the medical director and owner of First Call Medical Center. Dr. Ron, the CDC's guidance says travel within the U.S. is safe for people who have been vaccinated. They want people to delay international travel, but urge people that do return from other countries to get tested and self-isolate. So what do you make of this guidance, and do you expect all this traveling to contribute to another surge?
Well, good morning, and it's a good question. I think that, yes, there will be a second, or another surge, I should say, because we saw, as you just pointed out, Vlad, this past weekend, more travelers than we've seen since the start of the pandemic. Just to put this into perspective, in 2019, there were 2.5 million, the TSA recorded 2.5 million travelers on April 2nd. In 2020, it was 130,000. And as you pointed out, it was almost 1.6 million this past weekend. So the numbers are almost back to where they were in 2019. So, yes, I think there will be another surge. It's interesting that the CDC said that if you've been fully vaccinated, you don't need to be tested if you're traveling domestically. But if you're traveling internationally, you still do need to be tested. I'm not really sure why there's that discrepancy. But you know, it's the right thing to do. It's the CDC is doing the right thing. They're opening travel up to people, which they should be doing. And remember, full vaccination is determined 2 weeks after your last shot. So if you're getting Pfizer or Moderna, it's 2 weeks after your second shot. If you get Johnson & Johnson, it's 2 weeks after your one and only shot. That's what the CDC classifies fully vaccinated as.
Yeah, I guess I'm curious to know if the surge in travel is because people are getting vaccinated. I know, for example, here in New York State and in neighboring New Jersey, some 20% of the population has already been vaccinated. Are those the people that are traveling, or is it just people that feel, you know, they just had enough? The weather's getting nicer. People want to hit the road. You know, I've been looking myself into summer travel to New England, and you know, I normally go up to the New England coast, and I can't find any vacation homes available. It's just March or now early April. Everything seems to be booked up has fairly quickly booked up, and I'm just wondering if it's because people are just moving ahead with their plans, or if it's because you feel that they've become vaccinated.
Well, I think it's a mixture of both. My wife and I are both fully vaccinated. We're both physicians, and we both actually just traveled this past weekend. And I can tell you that a large number of people on the planes are still wearing the face shields and everything. I mean, obviously, everybody's still masked, but there's lots of people still with face shields and things. And I would presume that those people are not fully vaccinated, because once you're fully vaccinated, there's really no reason to wear a full face shield. So on a plane. So my guess is that there are still a large number of people who are still not vaccinated, who just have had enough and just want to get on with their lives and just travel.
So that brings me to my next question, which is a new strain of the coronavirus has made it to the U.S. Officials in California announced this weekend that a COVID-19 variant that first appeared, or first was discovered, I guess is the word, in India, has now appeared in the San Francisco Bay Area. What makes this variant different? And for folks who are getting vaccinated, I guess the question, and I guess we're going to learn in 6 months or so, are we protected from these variants with the vaccines that we're getting right now?
So what's interesting about this particular variant is that it's a double mutation, so that there's actually two mutations in the spike protein that appear in this particular strain of COVID-19. Now, that's not anything that's, again, unexpected. This is a very mutagenic virus, meaning that the coronaviruses tend to mutate at a very high rate. And as we know, it's going around the world, and it's in lots and lots of people, so it has lots of opportunity to mutate. So it's not unexpected that there will be one or two strains, or however many strains, with multiple mutations in them. The question that you asked is very important. You know, is this going to be more dangerous or more transmissible than prior strains? And there's no evidence to suggest that at this moment. Multiple experts have weighed in on this, and they don't necessarily believe that it's going to be either more dangerous or more infectious than prior strains, and that it will be immune to our vaccines. So at the moment, there's no reason people need to worry about it. It's just another variant that we're seeing. The more worrisome one really is the UK variant, which has now become the dominant variant. because it's 60 to 70% more transmissible and about 40 to 50% more lethal. So that's the one that that's the one that we need to worry about. But again, our vaccines are working against it. So, there's no reason to panic or for people to be scared.
And Dr. Elfenbein, just remind me, if you've been vaccinated, and we talk about these new variants and the transmissibility of them, but if you've received the vaccination, you may still come down with COVID-19, right? But the clinical trials and the work that's been done on people who've been vaccinated suggests that even if you become infected with COVID-19, you won't end up on a ventilator. You won't end up really struggling to survive.
Yes, great point. Thank you for making that. I think the most important take-home message for people to understand is that once you've been vaccinated with any of the 3 vaccines that are currently authorized in the United States, Johnson & Johnson, Moderna, and Pfizer, you will not die from COVID-19, or you will not end up on a ventilator or hospitalized. So all the data has shown that. You might come down with a mild case, you might have a cold, you might have a cough, you might have a little bit of flu-like illness, nothing to worry about, and you will not die from it. So the most important take-home message is that the vaccines impart protection from death. Any of the 3 vaccines. But again, the vaccines were not designed to keep people from getting COVID-19. They were designed to keep people from dying from COVID-19, and they have done a very, very good job of that.
That's a good point. A study out of England found that people who have already been infected with COVID-19 and get 1 dose of the Pfizer vaccine. Remember, our viewers should remember that you typically need 2 doses for the Pfizer vaccine. But if you get 1 dose, you have a stronger antibody response than someone who hasn't had the virus. What does that tell you about how the body reacts to it?
Well, it's interesting because we sort of in medicine, we sort of anecdotally knew that before the study came out. We saw, I had friends that had COVID-19, my brother also. And when they got vaccinated, they got very, very sick from the vaccine. And that usually correlates with somebody who's mounting a stronger immune response. Not necessarily, but usually that's the case. So we all kind of thought that people who've had COVID-19 are getting a much stronger immune response from the vaccine than people who hadn't. And this sort of study proves that. So, it's interesting because it shows that if you've had COVID-19 and you get the Pfizer shot, not only are your antibodies higher, but your T cell response is higher. So your entire immune response is sort of jacked up if you've already been exposed to the virus, which is great news. And that just shows that people that, yes, even if you've had COVID-19, a lot of people ask me, oh, well, I've had it. Do I still need to get the vaccine? Yes, you absolutely do, because the immune response lasts a lot longer after getting the shot than it does after just getting the virus. So this is good news, and it shows that people who've already had it are mounting a stronger response, and it may end up lasting longer than people who just get the shot. We don't know yet.
All right, Dr. Ron Elfenbein, always great to talk to you, sir. Thank you very much.
Thank you. Stay safe, Vlad.
You too.